this because we've heard so much about antibody testing during the pandemic. A doctor orders a blood test that looks for antibodies to the coronavirus, showing if you've maybe had the virus in the past. So how many tests have been completed at IU Health facilities and what are they finding? What do you need to know? Joining me live, Dr. Chris Weaver, Senior Vice President of Clinical Effectiveness at IU Health. Doctor, good morning to you.
Morning. Thank you, Angela.
Let's talk first about, and we're going to get into if the test really even means anything in a minute, okay? But let's just start with how many antibody tests you guys have done and what have you found?
So across our system, we've done a little over 1,000 antibody tests. We've had 50 positives, so 4 to 5% of our antibody tests have been positive across our system, which is pretty close to what the state has found in their seroprevalence studies across the state.
We so want to learn as much as possible about this virus, and we're trying to figure out if we have an antibody, does it mean that we're going to be protected a little bit more or not? Don't really know at this point. Is that still what you're telling people?
It is still what we're telling people. It's we're still learning about these tests. An antibody test is not for an acute infection. They're not looking to see if you're infected right now, but to see if you have been infected in the past. And there's just a lot of things we don't know. We're learning how good these tests are, and we're feeling better about how accurate they are if you have the antibodies. What we don't know is how many people develop antibodies if they've had the infection. If you do develop antibodies, whether that means that you are immune to the infection, and even if so, how long does that last? And so there's really just a whole lot of unanswered questions currently.
Is there anything that you feel like you do know at this point, like something that you feel very confident? We get asked so many questions, and lately really about testing, and people don't necessarily believe the test, or they think that we're lying about the numbers. What do you want people to know?
So I would say if for an infection, for somebody that we think might be actively infected with the virus and having symptoms, then the PCR test is the best test that we have for it. The biggest thing to know is none of these tests are perfect. We know that for sure. And so safe practices are the key. To wear your mask, to keep your distance from each other, wash your hands, all the safe practices that everybody's taught. I will say our state leaders and healthcare leaders across our state have done an incredible job preparing us for this. And we really just need to follow that advice. That's the key.
I have a friend who had 2 negative COVID tests. She just had to have the test because she was having a gallbladder surgery. She said she's never felt sick in the last 2 years, and her how she remembered it. While they were there at IU Health, they said, "Hey, we're doing this research. Can we test you?" She tested positive for the antibody, and now she's like, "Whoa! I don't think I've ever even been sick." What do you say to someone that's now testing positive for an antibody? Could they have maybe had a common cold and testing positive for antibody?
No, we don't believe so with the test we're using. But
Okay.
So one thing that has happened as we rush to find answers for this coronavirus that spread so quickly across our country, around the world, is that many tests that hit the market, and there's hundreds of antibody tests out there, they may pick up other viruses. They have a lot of problems with them. We are using a test that is, we feel pretty confident, specific to this coronavirus, to COVID-19. So she probably had an exposure to COVID-19 and just didn't have symptoms.
All right, Dr. Weaver, thank you so much. We'll have you back as you do learn more about the virus, antibodies, and how effective that is to maybe keeping somebody from getting it again or not. Good luck to you.
Great, thank you.
Absolutely. It's 8:44.